This is a message directed to President William Ruto. I've received so many messages from police, Magaskari or prison, AP, GSU, from all over the country. They are complaining about this SHA thing. And one of the reasons that these most police officers, au maskari wanafanya hii kazi, wamekuwa wataki kuacha hii kazi ni because wako na a good insurance, health insurance. Now umekuja ukamesa up. Hao maskari wamevumilia hizi house levy, hizi taxes zako, hizi pension zako zenye unawakata mara mbili, wamevumilia. But right now watu wamefika mwisho. Hii kazi imeletea watu high blood pressure, ugonjwa za sukari, and they are willing to continue with it. They were willing to continue with it because they had a good insurance. Walikuwa wanaenda hospitali wanatibiwa, wako na watoto wanatibiwa vile wanataka. And let me tell you, Mr. President, the reason why these people are working is because ni your insurance. Wako na watoto wanataka, they have a good medical cover, but right now you've taken that away from them. It is very dangerous, Mr. President, if you don't sort out this issue of SHA and medical cover askari. It's going to be very bad. These people are so mad, they are stressed out. And you know, one of the reasons why polisi wanakuangana brutal kwa wananchi ni because of frustrations zenye wameletewa na kazi yao. And these people are frustrated. Salary ni mbaya, health insurance hakuna, it's worse. I was talking to a certain lady, akaniambia like walimlipia tu insurance yenye ilikuwa hapo sijatu walimlipia 300 bob. And Mr. President, if you don't sort out these issues, these people are going to go slow. Even a strike, it's going to be so bad. And I'm going to talk about this, and I'm going to stand with these people. And Mr. President, you should sort this out. I'm telling you, you should sort it out. Say, I'm not saying you should staki kusema you should go. Say, nasema you should sort this issue out because these people are really suffering.
Bunga, ladies and gentlemen, welcome back to BAV. This is Bunge Audio Visual. And I'd like to welcome you guys and inform you that this is the place where we give a deep dive into Kenya's hottest topics. And I'm your host, Buffet. And today we unpack a brewing storm within our security forces, that is the National Police Service. So apparently police officers are increasingly voicing their frustrations. And this time it's about their health insurance. And some of the questions that are being asked is, could this be the beginning of a major standoff between the law enforcers and the government? So without further ado, let's break it down. But before we begin, I'd like to thank you guys for the 260 subscribers, and kindly continue subscribing to my channel for that, so that I can be able to be motivated, and so that you can be able to get more updates on whatever is happening, not only in Kenya, but across the globe as well. So let's begin. So the podcast is actually today's podcast. We actually discussing about the police officers versus the government due to the rising complaints that have been witnessed across various social media platforms. And you've seen the guy, the popular cop by the name Cop Shakur, has gone viral after he has been able to air out the kind of challenges that the police, but that those who are working under the National Police Service are going through. Yet the government hasn't done anything yet to resolve the issue that the guys whose slogan is utumishi kwa wote are actually going through. So let's begin. So let's talk about the growing discontent among police officers, because for a long time police officers in Kenya have silently endured their struggles, but now they are actually speaking out, and the latest issue is the collapse of their healthcare system. As you all know, at the moment, the current government state agency that is ensuring that the healthcare of the citizens is actually being handled as required is the Social Health Authority, that is a SHA. And under the Social Health Authority, we've been able to see modules like the SHIF, that is the Social Health Insurance Fund, that has currently replaced the NHIF, that is the National Hospital Insurance Fund. SHIF, after after NHIF was transitioned to SHIF, we were able to witness quite a number of criticism, or rather complaints that were aired, but or rather raised by the citizens of this country due to its failure to offer optimum services to the common mwananchi. Even though the common mwananchi is usually deducted each and every month over 500 Kenya shillings just to pay for the statutory deduction of social health insurance fund. But at the end of the day, he or she fails to get the required healthcare that he has paid for. So you've seen a viral video of a popular police officer, that is called Shakur, which has shaken social media. And in the video, he directly calls out President Ruto over failure of the newly introduced social health insurance fund, which replaced NHIF. And according to him, the system is not working, and many officers from different units, that is the administration police, we've got the traffic we've got the traffic police, we've got the Kenya prisons, and the GSU, that is the general service unit, have been able to complain about how silently they are suffering. But there is this guy by the name of Kop Shakur, who has actually been able to come and speak on their behalf, since Kop Shakur is liked due to him being vocal in nature. And by being vocal, Kop Shakur stated that the officers are deducted over 500 Kenya shillings monthly, yet when they or their family members fall ill, they are left stranded. And he also laments that the previous insurance system was much better and gave them the motivation to serve. So now what you need to know is that many officers are actually feeling frustrated and demotivated, because they apparently they've been abandoned by every government that they risk their lives for every day. And I think it has reached a point whereby they've had to say enough is enough. It's either the government listens to their cry as they serve the nation, or if that does not happen, then they're going to do something that would at least ensure that their message hits home. So amongst some of the questions that are actually standing out at this point in time, whereby the police officers are crying, or rather trying to express themselves, or rather express their anger or frustration over the failed insurance healthcare system, that is social health insurance fund. Some of the questions that guys are asking is, could this lead to a police protest? Because we've seen, in a shocking turn, Kop Shakur warns the president that if he does not address this crisis, the police might be forced to retaliate, and even suggesting that the possibility of demonstrations might come to life. You imagine that the very people meant to enforce law and order protesting against the government. You get? We've got the police officers who have actually mandated to ensure that there is the country is maintaining law and order. So now imagine if the same people who are supposed to enforce law and order decide to go out of order. What does this tell us about the depth of the crisis? You get? So there are quite a number of serious questions that we are supposed to be asking ourselves as citizens of this country, or rather as a nation. And some of the questions that we are supposed to be asking ourselves is, how can a country function if its laws enforcers feel neglected? Because you imagine how police officers, the kind of training these guys go through. These are some of the guys that have been able to, that were on the verge of giving up in life, but they decided to make that bold decision of joining the police service, just to ensure that they serve the nation and also get something, or rather a small privilege in enjoying some small rewards that one earns while serving that career. But now, instead of enjoying even the privileges that they once believed they were going to enjoy after passing out, now they're even facing more challenges in life. Of course, it's good to have challenges in life, because challenges help us grow as human beings. They help us come up with solutions. But to what extent? That is the biggest question. To what extent are we supposed to be experiencing challenges? And not supposed to be experiencing the same challenges day in, day out. Because it means if you're experiencing the same challenges day in, day out, it means that there is nothing that you're doing to ensure that you overcome that kind of challenge. We need to face new challenges each and every time. You cannot be experiencing the same challenge the time you entered the time you were 24 years till the time you are 37 years. It means that you as an individual are a failure. or there is somewhere you failed, or there is something that you haven't learned that can be able to ensure that you actually overcome that kind of challenge. And the second question I would like to ask is that why was NHIF scrapped if the alternative system is worse? Why was it scrapped? You get? When NHIF was working, people never complained. The police officers were working well. Their families were being treated well. In case there was a problem, or rather, if a police officer fell ill, he or she could be assisted as soon as he or she wanted that medical attention. But at the moment, with this social health insurance fund, now everybody's complaining, including the police officers. Now imagine the guys who are serving in the government are now complaining that they're being neglected by the same government that they're working for. You get, it's a very, very sad state of affairs. And we also need to ask ourselves, will the government respond, or will this tension continue to build? Because when this kind of tension continues to build, it means that it's going to tear this country to pieces. Because if you take a look at the public reaction and the next steps that are supposed to be taken, now you wonder, where as a country are we headed to? Because apparently the public has had mixed reactions, because some believe the government should immediately fix the issue of a failed healthcare system, while others argue that many Kenyans are also struggling under SHIF, not just the police. Now you tell me, if both the police and the civilians are arguing that this this transition of NHIF to SHIF hasn't ensured that hasn't guaranteed any improvement in the healthcare system, where do you think as your country we are headed to? So what I can say is that I think the guys who are actually responsible for this kind of, who are responsible for this kind of transition should just go back to their drawing board and meditate about it, or rather brainstorm and find out the best solution as soon as possible. Because if this issue isn't taken seriously, it means that the direction we are headed to as a country, only God can say more about that. I don't want to preempt, or rather just try and imagine what is actually going to happen. But what I can say is that we are heading in a very, very wrong direction, and it's a ticking time bomb for us as a nation. So I don't know what's your take, guys. Should the government rethink its approach to police welfare, or do you think officers taking to the streets is the right move in terms of when it comes to matters concerning this poor healthcare system by the name SHIF? Yeah, so I'll say that's it for today's episode, and this is Bunge Audio Visual. This is BAV. If you enjoy this discussion, make sure to like, subscribe, and share your thoughts in the comment section below, and let's keep the conversation going. Until next time, stay informed, stay safe, keep on subscribing to my channel for more informative content, not only in Kenya but across the globe as well. Thank you very much, and stay safe and be blessed.